Good morning. Thank you, Matthew. Happy New Year, everyone. Good morning, supervisors and community. Congratulations, Supervisor Rice, and thank you, Supervisor Rodoni, for excellent leadership and support in our public health response to the pandemic over the past year. We've got a lot of ground to cover. We're in a dynamic phase of our pandemic response. If I could have my slides, please, Alvaro. We'll start with our numbers and get into some of the key strategies and priorities moving forward. Next slide, please. This is our epidemic curve and shows the dramatic increase in cases we've seen in Marin just over the past really 2 weeks. Our highest number of cases ever on December 28th, 412 cases in one day. And comparing to the pre-Omicron era, the highest number of cases we had on any one day was in early January with 172 cases. So this is consistent with what's being seen essentially everywhere in the world where Omicron has become the dominant variant. Is remarkable increases, very rapid increases in cases where Omicron becomes the dominant variant over a period of about 2 weeks. That's our experience in Marin. But importantly, we'll get to what that means in terms of hospitalizations and severe illness shortly. Next slide, please. And this is the national picture. The CDC has the 4 tiers in terms of community transmission rates, red being the highest, and essentially the entire nation is in that high level of transmission. We in Marin County are well established. It's above 100 cases per 7 days on average per day. We're at 313 now. And our rates are among the lower case rates in the state of California. Next slide, please. And this, all along we have been describing our case rates by vaccination status to tell the story of how protective the vaccine is against infection. And that is true also for Omicron. What you see here is that our case rates among our unvaccinated residents are about 8 times higher than they are for our vaccinated residents. And now we've added another line here, which is the gray line, which is the case rates among boost residents who are not only fully vaccinated, but have had an extra dose, the booster. And it shows, as we know from the data from CDC and globally, that booster dose is indeed protective against infection itself, and even more importantly, protective against severe illness. So the lowest case rates are among our boosted residents, and then people who are fully vaccinated are also highly protected relative to people who are fully unvaccinated. Next slide, please. These are our hospitalization rates. We saw over the New Year's break a significant increase in the number of people with COVID-19 in the hospital. But I want to talk a little bit about how to interpret hospitalization rates. We as a county have really emphasized that we would be no longer looking at case rates per se as the signal of the burden of COVID-19 in our community, so much as looking at hospitalization rates to determine our policies. There's a nuance to even looking at hospitalization rates that I'd like to share with you. Next slide, please. And this is the difference between people who are hospitalized with COVID-19 versus people who are hospitalized for COVID-19. If you think about it, on any given day, there's about 250 people hospitalized in Marin County for whatever condition it might be. And that's our 3 hospitals, Marin Health, Kaiser, and Novato Community Hospital. Everyone who comes into the hospital is tested for COVID-19. As community prevalence increases, more and more of those individuals in the hospital will test positive because that's just probabilistic. It's being transmitted throughout the community. Only some are there because COVID-19 made them sick. So some people are hospitalized with COVID-19 infection because they have respiratory illness. They're short of breath because what the virus is doing physiologically. We consider those people to be admitted for COVID-19, and it's important to measure that as a sign of severity and burden of what the virus is doing to contribute to hospital surges. However, many now, an increasing number, are there for reasons unrelated to COVID-19, but are admitted with COVID-19 infection. And in fact, that infection is incidental. And the reason I'm sharing this is that now between 1/3 and 1/2 of the people in Marin County hospitals with COVID-19 are not there because of COVID-19 infection, but all are counted in the eyes of the state as COVID-19 hospitalizations. So just adding that caution and interpreting our numbers hospitalized when we're seeing such dramatic increases in cases, and it's something that I'll be sharing and trying to tease out in our future reporting. I'm trying to establish relationships with the hospitals where they're actually able to offer me that those who are there for COVID-19 infection versus those who are there who are incidentally infected, and we'll parse that out in our numbers moving forward. Next slide, please. These are our vaccination rates, and as many of you mentioned, we have it's one of our greatest asset really as a county in our pandemic response, and what will be the most protective element for us ongoing is our high vaccination rates. About 93% of our residents now who are eligible are fully vaccinated. Next slide, please. And this breaks down our vaccination rates by age, shows that our least vaccinated age group is our 5 to 11-year-olds. About 70% of that group has been vaccinated, which is a large margin above the next highest county. So we have the highest vaccination rates for our 5 to 11-year-olds. But we're seeing now with the Omicron surge, greater numbers of children coming into the hospital. So we hope that that's a stimulus to those parents that haven't yet chosen to vaccinate their children to come forward and get the protection of the vaccine. We have vaccine appointments, many appointments available through the month of January at various sites, including at our Northgate Shopping Center vaccination clinic. Next slide, please. These are our booster rates. This is a reassuring slide in that it shows that those people who are most at risk for severe illness, if they are infected, are our highest and most boosted population. About 80% now of our residents above age 65 have obtained the protection of the booster. But our goal is to get an even higher proportion of our whole population who are eligible to be boosted, that booster dose, especially as Omicron surges so dramatically in our community. And again, we have several thousand open appointments now through the month of January, even just at that one site at Northgate, in addition to your healthcare providers and pharmacies that can provide vaccine. Next slide, please. This breaks down our vaccine status in a different way as a county and shows that blue slice, that is the remaining fraction of unvaccinated people in Marin County. And in many counties, that is up to half of the total population. And the gray is people who are fully vaccinated, and yellow represents those that are fully vaccinated and boosted. So we have progress to make to increase our booster rates to mitigate the consequences of the Omicron surge. Next slide, please. So I'm going to get into some of our key strategies. Number one is to keep Marin schools open. Yesterday, today, this week, schools are reopening after the winter holiday. Over that winter holiday, there was also obviously a dramatic shift in the pandemic with Omicron becoming the dominant variant. And that represents new challenges for us in our goal to keep schools open. Marin County has always been firmly committed to opening schools and keeping them open. And that's going to be an ongoing priority for us. To review briefly some of the strategies, we tested all students and staff the day before return. We distributed 96,000 tests just before the winter holiday to make sure public, private, and parochial schools had access to home-based antigen testing with instructions on how to use a test and how to report the results. Some used those kits before the first day, so we were able to get more kids out. And I'll share the results of those preliminary tests in a second. We're also having a meeting later today with the school community to review the modifications to our 32-point plan. Right from the beginning, when we first started reopening schools, we went with a 32-point plan, which would really be the blueprint for us in terms of how we're going to keep schools safe as we go back to in-classroom learning. That has been revised now 3 times. Today will be the 3rd time that we've done a revision to that plan, and this is responsive to Omicron. The elements of the revisions are enhanced mask use, We're going to recommend that no more assemblies occur on campus for the short term, as we're dealing with Omicron. And we're going to recommend that no spectators attend any indoor sporting events. We've seen significant transmission at basketball games, volleyball games, et cetera. Omicron is so highly infectious that any one individual in a setting like that may not recognize they're infected, can infect a large number of others. So it's sort of an obvious strategy to reduce the burden of the total number of cases that might emerge from a large gathering of everyone indoors at the same time when everyone's yelling and that goes along with a sporting event like that. Testing at home for symptoms is another key strategy for us. We're distributing more test kits later this week to students and families. Test to stay will be an important strategy also, where if a child is exposed in the classroom, rather than have that child have to quarantine automatically, they can test on a regular basis. And as long as that test remains negative, they can stay in the classroom. And then we'll be implementing the new isolation and quarantine guidance from CDC, which has been modified by California Department of Public Health, which I'll review shortly. Next slide, please. These are the preliminary results of our return to school testing on January 4th. These are partial results. There were two different reporting arms. There's one primary health platform, primary.health. It's software that many of the schools use to get the results. And then there's the county jot form for those schools that weren't able to use primary.health. This is the results from our county reporting, so it's only partial, but it basically showed over 10,000 results have already come in, with about a consistent 4% positivity between staff and students. And unfortunately, this is not unexpected. You know, we knew that Omicron is, because it's so highly contagious and it has moved so quickly across not only our community, but across the nation, that a 4% positivity was about what we would expect at this point. And the good news about performing these tests is that those individuals are now isolating rather than coming into the school setting and fueling more transmission in that setting. Next slide, please. So let's step back and think about severity of Omicron. If I have any concerns about the surge in cases, it's obviously that we would see more hospitalizations and deaths. And I would like to just kind of step back and think about what the physiology is and what the data is showing us from the UK and other parts of the world, where they're sort of further along into this surge, to learn what our experience might be. The United Kingdom recent study really very thoroughly evaluated the characteristics of people coming into the hospital with Omicron. What they found was that hospitalization risk was 3 times lower than it was for Delta. So much lower hospitalization rates. And then among those hospitalized, 1 in 15 individuals required intensive care, compared to 1 in 5 with Delta. So much higher rate of people requiring oxygen, requiring intubation, requiring intensive care with Delta than with Omicron. And then there's other data and other physiologic studies that show that some of the mutations of the Omicron variant actually allow it to reproduce more successfully in the upper airways, in the throat, and less successfully in the lower airway, in the alveoli, in the part of the lung where actually oxygen is exchanged. That's the critical and very delicate lung tissue that if there's a lot of inflammation, you can actually end up having respiratory distress. When people die from COVID-19 infection, it's most commonly because of the pneumonia and the effect on the lower airways. And what we're seeing is much less frequency of lower airway disease with Omicron than we had with Delta, which is a critical difference between the two and is a natural property of that variant. Next slide, please. And we've seen that in our own data. When people obtain testing in Marin, we do a query of what their symptoms might be. And interestingly and importantly, we've seen a shift in the symptoms that people are reporting when they are testing and they test positive now versus before. We're assuming that everyone in the last 2 weeks who's been tested is probably, if they are infected, it's with the Omicron variant. We really saw that surge starting around December 20th. And so we can look at a time frame and say this is assumed to be Omicron, and an earlier time frame to say this is assumed to be Delta. And now what we're seeing is there's a shift in symptoms. More recently, 20% more people are reporting sore throat as the primary symptom. And a significant, fewer are reporting shortness of breath as a significant symptom. And so this is a local validation of what we know to be happening elsewhere, which is there's more common cold-like symptoms and less common pneumonia-like symptoms due to the Omicron variant. Next slide, please. And then this is just this is a way of describing what we are still remain concerned about, despite the fact that the hospitalization rate may be lower for Omicron and that the physiology is favorable in terms of less severe illness. On the left there, you have, the Delta scenario where you end up with three. The red are 3 individuals who would end up in the hospital with that number of cases in the green. And then on the right, you have an Omicron scenario where you have a lot more people a lot more cases. You actually end up with potentially more people hospitalized, even though the hospitalization rate is lower. So this is just a way of sort of showing the social math of that concern that despite the fact that it's less virulent, we might still see surges of people coming into the hospital just by virtue of the raw numbers of people who are infected. Next slide, please. So we will expect, and had many of you in our community have already experienced Omicron coming closer to home in your families or even as individuals. So we want to be very clear with people how to respond to a positive test. So just going to go through quickly now what the new expectations are with regards to quarantine and isolation for tests. So if you test positive for COVID-19, here's how to stay safe. Next slide, please. And this is information we put on our website and be distributing through social media as well. So this is now the new quarantine, no isolation guidance for cases. From day 1 to 5, you need to isolate from other members. So as best you can, isolate at home, separated from other members of your household, and you're not going to work, you're not going to school. You're really you're seeing yourself as someone who can infect anyone else you come into contact with, and you're isolating. What's new is that if you test on the 5th day, and that test is negative and your symptoms are improved, you can come out of isolation. It used to be 10 days. So we've actually shortened that by 5 full days with a negative test. And then for the remainder of 5 days out to 10 days, you need to wear a mask anytime you're around anyone else outside of your household. Next slide, please. If you've had close contact, so that was isolation, we're going to get into quarantine. If you had close contact with someone with COVID-19, you may or may not be infected. So the principle here is that we need to give time to see whether or not you became infected. And during that time, make sure that you're not potentially infecting others. Next slide, please. So if you've been boosted or have been recently fully vaccinated, so you may not be eligible for a booster because you were fully vaccinated so recently, but if you are eligible for a booster but haven't been and have gotten the booster, this is the rules for you. You don't need to quarantine if you've had a close contact. What we want you to do is to test on day 5. And if you've been exposed, then if you've been infected, then you go to the isolation guidance. But you do need to wear a mask around others for at least 10 days, especially in indoor settings. Next slide, please. However, if you are eligible to be boosted and have not gotten the booster dose, or if you're unvaccinated, you do need to quarantine if you are exposed. So you need to stay out, you basically follow the isolation guidance that I just offered for 5 days. You can test on day 5. And if you do test negative on day 5, you can leave your house and cover your face and go along with your business. Next slide, please. So that was isolation and quarantine in a nutshell, and that's the details are on our website. And this is what I just shared as following California Department of Public Health guidance responsive to the CDC's new federal guidance. We have a vaccination policy update. So our local order mandatory booster at least twice weekly testing for first responders by January 28th. We already have an order in place for first responders. That's law enforcement, fire, emergency medical services. They need to be fully vaccinated or tested. We just added the requirement that people obtain that booster dose as well, knowing that it's necessary for the full protection. And then also over the past few days, the state order of mandatory booster for healthcare and long-term care facility staff by February 1st, requirement that they're fully vaccinated or have a religious or medical exemption. Now we've added a booster to that. And those who are exempted religiously or medically require twice weekly testing. Next slide, please. So stepping back, setting some expectations for us as we come into this chapter of the pandemic. Most of us will experience infection personally or in our immediate family or social circles. And that's the reality of Omicron. In London, there was, I think, 1 in 7 individuals at one point at the peak was infected. So you think about that, for Marin, if it was 1 in 10, that'd be 25,000 people. We have 250,000 residents. So even greater numbers. The good news is that we are highly protected because of our high vaccination rates, and that Omicron is a naturally less virulent variant, as I just described. We are expecting, and I think the biggest threat for us, the biggest concern would be disruptions to essential services due to absences, especially in critical infrastructure, our schools, our healthcare, our hospitals, our long-term care facilities. And that's why that new modified isolation and quarantine is important, because it foreshortens the interval of time someone who's infected needs to be away from work or not able to do their basic functions within their family if they're a caregiver. Vaccinations, as we've already said, are our best tool, masking and testing. Next slide, please. And this is a good time to just step back and really ground ourselves in our fundamental values around health. And we, from the beginning of this pandemic in Marin County Public Health, have looked to the World Health Organization definition of health, which is a more holistic understanding of health and well-being, which is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And the reason I'm emphasizing this now is that if our goals remain preventing every infection, we would be coming back into a lockdown scenario, because we know that the virus is so widely being circulating in our community. And we are not looking to those sorts of policies now, because we know they would actually yield more harm for us in social and mental health domain. And we're reassured that because of our high vaccination rates and the properties of the Omicron variant, that we'll be okay as we move into this next chapter. Next slide, please. Thank you. That concludes my presentation.
All right. Thank you, Dr. Willis, as always.